YouTube. I am coming to you guys to do a what's in my nursing bag. I thought this would be a really cute fun video to do just for nursing school. I know I haven't really made a video on how things have been going. I now have been in nursing school coming on my 3rd month. It is flying by, you guys. Like, it's going so fast. So I was like, let me show them what I take to lab. For all you guys who are in nursing school who are in lab, or you're going to start nursing school maybe next semester and you want to know what you will have in a lab bag. So let's get started. Alright, so this is my lab bag and it has my name on it. So cute. I actually got this off of Amazon and it was 30 bucks, and it has like, it's a stethoscope and it has like a heart made out of the stethoscope and it has my name in the middle. It was $30 for the like name on it and everything like that. You're also able to pick your color, like what color you want your stethoscope to be. And they also have different designs. They had some bags that had like RN on it and like a little I think syringe. I was gonna get that one, but I was like, you know, let me wait until I get, you know, to the last semester, and then I'll probably get me a new bag that has all that on it. I'm the type of person, like, I like to speak things into existence, but I don't like to overdo myself either. So I was like, let me get this bag. Alright, so pretty much first thing I always keep in my lab bag is sanitizer. You will be touching a lot on mannequins, on your classmates. There's some labs we did, like vital signs, you'll do, you know, blood pressure and so forth. Respirations, you have to feel on their chest. Cardiac, I had to literally, like, you know, fill up on, you know, the person to try to hear the heart sounds. We also had to like do reflexes and so forth, and I think it's Babinitsky, how do you say it, and where you have to kind of draw an upside down J on the person's foot. So you're going to be doing a lot of touching on your classmates, so you always keep sanitized. Also keep just tissue in here, just because you're there all day and I like to have tissue. Just if I have to wipe my mouth or clean myself up, I have like a pack of tissue kind of to help me out. What else? Oh yeah, I always keep aspirin or Excedrin in my bag, because sometimes I get really bad headaches, so I like to keep Excedrin in here. I also put not just Excedrin, but I put some of my ibuprofen because I get really bad cramps, and I learned my lesson the hard way, because one time I started my period at lab and I thought it was going to come like later, because I usually start my period on the weekends, but I started my period freaking at school in lab, like, and I was miserable. My stomach was hurting so bad. I had no pills, no pads. I was in there rolling up tissue paper really ratchetly, because I was like, oh my gosh, I started my period. So always keep some pills in there. Also pads, that's another thing in here. I have like a little bag that has pads. I'll put it in there right before, like if I know my period is gonna come up kind of soon, I'll just put the bag in here. I'm not gonna show you guys because I don't want like pads all everything, but I keep like a little black bag. It has my pads in it, and literally, so like when I start cramping and feeling like, okay, I think my period's gonna come on this week, I'll put it in my bag so that if it does happen while I'm at school, I'm not unprepared. I kind of have all my stuff with me. So yeah. Next, I have gloves. I just keep extra gloves in there, especially now we're doing catheters and so forth, so I like to keep a lot of gloves in my bag. In nursing school, you will, when you're in lab, there's like a closet that they have a lot of supplies. If you have gloves that don't fit you, because I know at our school we had to buy like a nursing kit, and it has like all of our stuff that we'll use through nursing school for different labs and clinical things. So if you have gloves that don't fit in your bag or whatever, or the gloves that they give you, ask them, you know, hey, can I go in the closet and get me some gloves? And they'll say, yeah, you can take some. So if you need to, you know, ask your teachers and instructors if you can take anything out the closet, like gloves or whatever, wipes, take them and keep some in your bag, because when you're at home practicing, you don't want to be trying to practice catheters with gloves that don't fit. Okay, so if they are recommending or saying you can go in that closet, girl, and take whatever you need, take whatever you need, okay? Because if they're giving it to you, definitely take it. I also have my glasses. We haven't used these yet, but I just keep them in here just in case. So I always keep glasses in there. These are just my goggles. My school actually gave me these. I did buy me some, but I was like, let me just use the ones they gave me. I also keep hand lotion. Always keep hand lotion. Again, if you're sanitizing a lot and washing your hands a lot, you definitely need lotion because your hands will get dry. I also keep my pen case and our pen, highlighter, everything case. I like to write with a lot of different color pens because it helps me remember stuff really well. Also different color highlighters. I also keep all my black pens in here because when you're in nursing school, you will notice that pens disappear. Not even intentionally, but sometimes you just lose them or you misplace them, or maybe you let someone borrow it and you totally forgot. Or sometimes in lab, you're doing stuff, you're writing stuff, you know, you might want to write something down, or we have like a little, almost like a, what is it called? At the end of lab, we have a little sheet that we fill out and we like rate ourselves, like if we think we came to class, you know, dressed appropriate, doing what we're supposed to do, and then our instructor like signs off on it and rates us as well. And sometimes you have your pen and you might sit it down somewhere and someone might pick it up thinking it's their pen, or on accident, so pens get lost. So I try to just keep my pens in my pen case and keep a lot of pens on you, because again, you don't want to be that person who you only have one pen on you all the time and then one day you forget. And you will learn in nursing school, people are stingy. They will not want to give you your pen. You ask somebody, hey girl, can I get a pen? And she'll look at you like, okay, like hesitant. Like people will be hesitant to give you pen, which is understandable because we have to use freaking permanent marker black pens or blue pens, and those things are not cheap, y'all. Like these Sharpie pens are not cheap, so I can understand why someone doesn't want to give me the pen. So always keep like a pouch with pens, extra pens, have more than you need, because again, they will go missing. Next, I have my Jarvis book, and this is the book that we required for lab. It's a pocket companion, and we use this because at checkoffs we are supposed to document at the end of it, and this book helps with documenting. It also helps you to use the correct it also helps you use the correct terminology when you're documenting. So you know, like with pulse, you know, and respirations and so forth, different numbers, just different ways to describe your checkoffs. This book is perfect for that. We're actually allowed to use this at checkoff, so when we are writing down and documenting, we can kind of pull this book out and use it to help us. I also tab, so every checkoff, like whatever we're doing, whether it's, you know, again, respiratory, vital signs, pulse, anything like that, musculoskeletal, I just tab it. And I just kind of, sometimes I put little notes in there just so that when I do document, I'm not having a hard time. I can just easily go be like, oh yeah, this is this one. Oh yeah, this is this, you know, oh yeah, this means this. So I use this. I don't know how other nursing schools are, but I'm pretty sure all nursing school have a little book that you should carry around for lab and clinical type of setting. So definitely always keep, you know, whatever book they require for lab, definitely always keep it in your lab bag so you don't forget it. Okay, next I have my, this is just my lab binder. My little sister wrote on it, so if you're wondering what all this is. I used to have just one binder that had all my lab stuff and all my class stuff, but in nursing school you'll realize that you print a lot of stuff out, so one binder sometimes is too much. It gets kind of unorganized, so I just separated my binders. So this is just my lab one. I just broke it up in tabs, so I just have a whole bunch of different tabs and I can write on them. And pretty much I just broke it up with lab notes, so everything that they ask us to print out for lab. I also have a checkoff tab that has, you know, our lab evaluation form, which is what I told you guys earlier, where the instructor kind of rates you on your appearance and how you did in lab, and also you rate yourself. I also have just our checkoff forms. We get like a little form that kind of is a head and toe physical assessment, and it pretty much just has, you know, what we're going to be doing, and I keep that. I also keep any items that we might have to turn in, so say we had an assignment, I'll just have a tab for that. So if you're in lab, definitely have a separate folder because it keeps things really organized. Okay, so these are my stethoscope. I also keep these in my bag, and I love my stethoscope so much. I got two. I know y'all like, girl, why you get two? I don't know, I just felt like being extra. So this is my rose gold one, and both of these stethoscopes are MDF. Now that's another thing, when you get into nursing school, everybody's going to be like, Lippman this, Lippman that, Lippman this. And when I tell you, there's been times in lab where we're listening to lung sounds, stomach, heart, and people are like, I can't hear it. You know, doing blood pressure, people are like, I can't hear it. Especially on the mannequins, people are like, I don't hear a dang thing. And I pull my bad boy out and I'm like, I can hear it, girl. Because this thing is really good. My mom was like, girl, get an MDF, they sound really good. And I thought she was just talking, but these things are so good. They're really affordable and they're really good quality. So definitely check out MDF if you're in nursing school, before you just run and get new expensive Lippman. So yeah, these are my two. I prefer the rose gold one because this one was $80 as well, and it's longer, but and it's longer pretty much. So I like to use it for vitals, like blood pressure and so forth, and also listening to stomach sounds, because when you're listening to the stomach, you'll know that the person will be kind of flat on the bed, and or like flat wherever they're at, and you have to kind of listen. And if you have a short stethoscope, you're gonna have to kind of lean over and like listen, and it can kind of hurt your back a little bit. So I prefer this stethoscope for that. For heart sounds and lung sounds, I prefer this stethoscope, which this one was $100. It's a little pricey, but it's really good quality and it's all black, so I thought it was really cute. But I like this one because, again, this stethoscope was actually made specifically for people who use it a lot for heart sounds and so forth. Like the name of it is the classic cardiology stethoscope. So as you can see, it's shorter, so it's really good for listening to heart sounds because heart, you know, bam bam, and lung sounds because it's bam bam. You don't have to really bend over or do a lot of stuff, and it's really clear for those things. So yeah, these are my two babies. I keep them in my bag, but don't keep them tangled up in your bag too long. I like to, like in the morning, I'll throw it in my bag, and as soon as I get in the car, I'll take it out and put it around my neck, because when you have your stethoscope kind of balled up like this, it'll mess up the tubing, and over time you'll notice that you can't really hear that good. And most nursing students, they keep their stethoscopes throughout nursing school. They may possibly get, you know, like me, you just buy an extra one because you think it's cute, but you try to keep it as long as you can because stethoscopes aren't cheap, so you don't want to mess it up. Another thing I keep in my lab bag is this pouch, and this is my makeup slash hygiene slash things that I need, but I just want it all together bag. I keep like lip gloss in here, and all my lipsticks are in here. I also keep deodorant. You want to keep an extra thing of deodorant because sometimes when you're in them thick scrubs, it gets hot and you get funky. So keep some deodorant on you. I also keep a mirror, and this mirror is really cool. It's the Joyous mirror, and let me show you guys what it does. You click it twice and it turns into a light, and this comes in handy if you can't like go to the bathroom, or you know, maybe you're at lunch and you just don't feel like going into the bathroom, or you know, I don't know, if you're just in the middle of class and you just want to look at yourself, you can pull that out. I also keep earplugs in here. These are really good for testing purposes, just because, you know, when you are testing, sometimes noise can make you just unfocused, so I like to keep earplugs in my bag. I also have my pen light, and this comes in handy for when you're doing neurological checkoff, and other checkoffs. You might have to look in someone's mouth or look at their eyes, so I like to keep my pen light on me. I also have like different brushes and stuff just in case I have to do my makeup in the car. I also keep my scissors. We haven't used these yet, but I just keep them just in case, because I hate when you don't bring something, your teacher's like, bring, you know, take out your scissors or take out your pen light, and I'm just like, darn it, I don't have it. Alright, another thing that I keep in my nursing bag is going to be a secondhand watch. A secondhand watch is required with our uniform. We have to, I know at our school, our uniform requirements are, our hair has to be up off our shoulders, short nails, of course, no nail polish, and we have to have a watch on. Even if we're not using it, that's just part of the uniform policy. You just have to have a watch on. And it has to be secondhand. Now, I know some people say, you know, can we wear an Apple Watch? Technically, no. You're not supposed to wear an Apple Watch. I guess they just want you to learn how to use a secondhand watch, because that's kind of how most nurses were taught, you know, older nurses. So that is a requirement. Of course, you know, more than likely if you work in the hospital field, you can probably wear an Apple Watch. And like when you're doing blood pressure, you can just kind of set your Apple Watch on timer, or like look at it, you know, it has the little seconds on the side, and do that. But we do have to use an old-fashioned two-hand watch. This watch is one my mom gave me. It is a breast cancer watch, so it's pink, and I like this watch too for school because it's like really flexible at the wrist, so it's not too tight and uncomfortable. And two, it's not too fancy. It's like simple, cute, but not too fancy. I don't recommend having a super fancy watch, because if you wear that when we go to hospital, what if somebody like coughs on it, or what if somebody breaks it and yanks on it? You know, you're going to be kind of distraught if you have a freaking $200 watch on, versus if you have like a $20 cute watch that, you know. And you can also get cute watches at Kohl's for like $20. Sometimes they have like $10 sales. So don't spend too much money on a watch and you're wearing it to class and to lab and to hospital, because if it breaks, then you're gonna be mad. So also, another thing, I can't of course show it, but I keep my badge in my bag. Usually it's definitely a good tip to take your badge off as soon as you finish lab, unless your shirt is really clean and y'all ain't do nothing crazy and you just want to hang it back up and keep everything on it. But if it gets dirty for whatever reason, you have to wash it, definitely always remember to put it back in your bag, because again, your badge is part of your uniform. If you do not have your badge on, you're out of uniform, and you can't either A, get dock points at the end of lab when they have to do your rating, or if you have a mean instructor, they may literally just say you need to go home, you're out of uniform. Which just know my instructors are really nice and cool because they're young and they're happy. But of course, some instructors are going to be older and maybe burnt out and just over people, so they're going to be like really strict. So you don't want to test the water. Plus, you never know, because sometimes, you know, as any person, you have your good days and maybe one day you have a bad day, and you don't want to catch your instructor on a bad day and she's like, you know what, I'm fed up, like, you need to leave, you're not in uniform. Or maybe you're always out of uniform and she's really just like, I'm done with you. So try to keep yourself in uniform at all times. Remember, like, I keep, again, my badge and my watch in my bag, things that are requirements, because you don't want to forget the things that are a requirement, because again, you don't want to accidentally get kicked out of lab and have to make it up, because when you miss lab, you have to come back and do another lab day, which can mean extra time. You have to try to figure out, you know, like, especially if you work, you have to try to figure out how you're going to get back to school and make up your lab. So avoid that. Alright, you guys, so thank you guys so much for watching, and hope that you guys enjoyed this video. If you guys have any more questions about nursing school, or want me to do any other videos on any other nursing topics, definitely let me know. I will try to do a video kind of updating you guys on nursing school and how everything is going. So yeah, if you guys want to see anything else, just let me know. And as always, thank you guys so much for watching, and hope that you guys enjoy. Have a blessed day, y'all. Bye.